Hello, everyone, and hope you're having a good time attending our sessions and listening to some great insights shared by our speakers today. And hope you've had the chance to visit the exhibition hall and meet our partners to explore some transformation products and services. And it is now time for an exciting fireside chat with Dr. Jamie Mervyn Lim, COO of TTSH and Central Health, on the topic Reinventing Operating Models to Accelerate Growth in the Digital Era. With the shift in demand and supply chain, there's a need for businesses to relook at their operating models. The flexible workplaces and new ways of working demand have added to the urgency of reinventing operating models. In this fireside chat today, we will explore how COOs can reinvent their operating models for accelerating business growth. And some of the key takeaways from the session for our audience would be, what do you need to take care of while selecting an operation for reinventing? What are the black holes of reinventing operating models and how can you address them? And how can you use technology for re-engineering the operating models for the digital world? And with great pleasure, I would like to invite our speaker for this session, Dr. Jamie Mervyn Lim, Chief Operating Officer at Tock, Seng Hospital and Central Health, Singapore. Dr. Jamie oversees the daily operations of the hospital. A strong advocate of systems thinking, he introduced a more systems-based approach in managing key resources at TTSH. He incorporated systems dynamic thinking, artificial intelligence, and spearheaded the development of a command, control, and communication system to successfully manage a 1,600-bed hospital. Dr. Lim also chaired hospital-level committees that led the transformation of clinics and wards, which were both recognized locally and regionally for their best practices. It would be great if our audience today could keep sharing their questions and comments in the chat box section during the session. You might stand a chance to win some exciting prizes too. And without any further ado, let me begin this exciting fireside chat with Jamie. Jamie, thank you for joining us. It's a pleasure to have you.
Thank you, Yasmin. It's a pleasure to be on this fireside chat. Thank you very much.
Great, thank you so much. So Jamie, let's start this conversation by talking about the challenges first. And we know we are again living in an uncertain world. So tell us about the challenges and opportunities that the pandemic brought to the forefront. With flexible working and a sudden digital change, the reinvention of operating models was wholly banked on urgency, actually. So how did you navigate these unprecedented challenges? And what are some of the most important lessons that you've learned that will be imperative for the future also?
Well, Yasmin, I think the pandemic was really a game changer. And, in many industries that were hit by the pandemic, the reinvention of the operating model was really a crucial means of survival. It was business survival. So, for example, the airlines in the aviation industry, no one was flying out of the country, food and beverage, the restaurants were empty, retail malls were shut. But in my context, it was totally different.
Exactly.
I would say that I had an opposite problem to many of the other industries. In fact, in healthcare, we had a spike in workload because the COVID cases were increasing day on day. And these cases had to be handled very differently, given that we knew so little about COVID at that point in time, in the early 2020. And it was a very novel virus to the healthcare sector. Not only do we have to manage COVID, I also had the challenge that I had to manage my business as usual load. So it was almost a double whammy because I had COVID to handle and I also had my business as usual. And even in times of a pandemic, people do fall sick, not because of COVID, but the usual diseases, right? The diabetes, car accidents, people still come to the hospitals for trauma and things like that. So the demand doesn't change. And the context is that because of COVID, people cannot come to the hospital. We had to divert resources to support the National Center for Infectious Diseases in Singapore. And patients were also afraid to come to the hospital. That's the truth. They didn't want to come to the hospital. They deemed the hospital as a risky place to go to. So I think the operating environment over the last 2 years was a challenge where I had to be able to maintain business continuity for my BAU cases, the business as usual cases, to ensure that these patients are being cared for. And I think COVID itself presents a few challenges and opportunities which you were asking. Number one was changing mindset of the customer and also our own staff. in healthcare, we always deem healthcare as a very high touch, face-to-face kind of industry, right? You need the doctor to be beside the patient, to examine the patient, come up with a diagnosis. And if you want to change that, moving away from high touch to digitalization, a change in mindset is required. And a change in mindset from both the patients and the staff itself. And I think the timing is very important. COVID presents us, well, unfortunately or fortunately, the opportunity for us to digitalize many of these interactions that we have with our patient. The truth is that we have been trying to do digitalization for the last 3 to 5 years, and there has always been challenges because of mindset. You can't do it. You lose that personal touch. But COVID totally changed that overnight, and it helped when in Singapore there was also a national initiative for safe management. So in terms of checking into the malls, checking into the restaurants, people will need to use their mobile phones, and they will need to scan a QR code. And then what happened was that overnight, everybody became digital, right? Those who were naive or not conversant with the mobile phones became very conversant with them immediately, right? Because they had to use the phones to get around the shopping malls, the restaurants, so on and so forth. So I think timing was important, and timing helped to facilitate a mindset change. Well, the second thing was that when we talk about a BCP plan, or business continuity plan, it was really as good. The BC plan is really as good as the scenarios that we put in. And this COVID has taught us a few lessons. Number one is that you can plan out your business continuity planning to the T, but you really need to be guided by broad principles, because the scenarios will never be exactly the same, right? So having guiding principles are actually more important to me. And this COVID outbreak has taught us a few things, because our BCP was planned very much based on the SARS experience. If you remember in 2003, when Asia was hit by SARS, Tock Seng was actually the SARS hospital for Singapore. So we have the National Center of Infectious Diseases with us, still with us. And many of our pandemic outbreak kind of planning were based on SARS, which is low volume, high mortality. But you realize that COVID turns it totally upside down. COVID is high volume, low mortality, and which means that we need a BCP plan to be able to manage a high volume of patients coming in. But these patients may not be as ill as the SARS situation 10 to 12 years ago. So the BC plan had to evolve as well, and we fall back on principles, guiding principles, because the scenarios that we were planning for were totally different. So I think those are some of the challenges that we face, that we were able to sort of respond effectively if you are able to be guided by broad principles. The third and the last thing probably is technology. We use a lot of technology, and we see that as a productivity multiplier. So we use technology in terms of robots, sensors, safe distancing, making sure that the crowd disperse, there's no one congregating together. And robots are very, very useful. Yes. Because you don't quarantine robots, and they work 24/7, right? And they help you to go into places which are considered higher risk. Yes. So the infectious disease wards and things like that. And so that helped us to save manpower, to conserve manpower, prevent manpower fatigue, help us to be more productive. So I think those are the things which we learned over the last 2 years of the pandemic, and clearly that shaped the way we evolve our operating model moving ahead.
More ahead. Great thoughts. Thank you so much, Dr. Jamie. I think, yes, the healthcare sector has gone through a completely different transformation in the past 2 years. And as you said, broad guiding principles, yes, you had to do business as usual also, and you had to take care of a huge pandemic, which was kind of destroying the world at one point. So you've done a great job. I think kudos to everybody in the healthcare sector. And the fight is still on, not that it's over. And it's great to know that, the lessons that you've learned and how technology has also helped you evolve and step up to the kind of demand that has come up in the past 2 years specifically. So some great lessons shared. Thank you so much, Dr. Jamie. Moving on, the second question that I have with you is about with continually shifting demands in the new normal, we're still seeing changes happening. A recalibration of operating models is the need of the hour, and we just spoke a bit about that as well. So what, as COOs, are the factors you prioritize to reinvent your operating models? Have they transformed in the wake of the digital evolution of workplaces?
I would keep the answer very short. I would narrow it down to a few words. So it's faster, better, cheaper, safer, and happier.
All right.
So what do I mean by that? I mean, we need to be operationally more efficient because manpower is a constraint. To be operationally efficient, I also need real-time information. So sensors on the ground are very important, and that's where we leverage on technology. Whilst we use a lot of technology, I need to make sure that the patients do feel that they are being cared for despite the lack of face-to-face. So even as we do teleconsultation, the patients must feel that the doctor is still caring for them, even though it's virtually over the computer. Operating models would change, but we need to ensure that the patient safety is maintained. So there are certain things that we can't do virtually. We may have to see the patient physically. So there is a bit of a hybrid kind of operating model. Not everything is virtual, but not everything can be physical on site as well. So it's a hybrid. Patient safety must be maintained. And I think overall, we need to reduce our overhead costs, lower the costs, lower the bill size to the patient to keep healthcare affordable to the patients, and then pass on the savings to the patients as well. The last part about happier is about the happier workforce. Healthcare is under a lot of strain over the last 2 years. I need to keep morale up. So anything that can help the staff to make their work easier, make it safer, will lead to a happier workforce. And we want to prevent the burnout of the workforce in the healthcare sector as well. So those are my considerations when we talk about reinventing, the operating model.
I think those are some great points. I think what I pick up is faster, safer, cheaper, happier. So overall, it creates an operating model that not only cares for the business, but cares for the people at the same time. And I saw a very interesting video of TTSH actually a while ago, where you have this entire touchless experience for any patient who enters the hospital. And it was so beautifully done, the way you've taken up the whole digital, innovations that can help you create a better workplace and a better hospital for your patients. I think that's kudos to you. So thanks for sharing that, Dr. Jamie. Moving on to the third question for this conversation today. So the change and transformation of operating models usually stem from the dynamic workplace transformations. Operating models thus can be known as representations of business transformations. Which operating models have worked for business in accelerating growth in the past decade, according to you?
Yeah, so I'm going to talk about healthcare since I'm familiar. And the traditional model of healthcare is patients coming to the hospital to be treated, right? In the new operating model, we need to look at a hospital without walls, right? Figuratively, without walls. And what do we mean by that? We mean that care would have to follow the patient. So you do not have to come physically on site to the hospital. We can monitor you remotely. We can go out there and reach out to you. When you are in your home, when you're out in the community, we can make sure that the care process follows you out there. So you can be cared for anywhere in the community. You don't have to come to the hospital. And in order to do that, there'll be process changes, there'll be workflow redesign, and there'll be a lot of use of technology as well in order to monitor. So to me, that is the main driver that we will see over the coming years.
Okay, great. Thanks. Thanks for sharing that. That actually brings me to the fourth question of our fireside chat today. So we're talking about technology, and you say, how do you create that experience where there's a touchless experience for your patients entering the world, entering the hospital. So the imminent impact of technology based on the past 2 years patterns of digital transformation, this needs to be navigated conscientiously. How can COOs best use technology to re-engineer operating models for an increasingly digital world, Dr. Jamie?
I would answer that question from a few perspectives. The first one is that technology is sexy, right? It's the in thing to do. But we should not be blinded by the fact that we are leveraging on technology for the sake of technology because it's sexy. Right? I think technology needs to bring value to the customer and in my case to the patients. So what is it that the patients really value from the interaction with you as a provider? And how can technology then be a facilitator? Right? So if you use technology, then you need to review your processes, because the last thing that you want to do is to use technology to facilitate an archaic and inefficient process. Right? So you need to go back to basics and look at the processes first, review the process, and then leverage technology on it as a facilitator. And once you have done that, then clearly the staff that you have must then be trained to use the technology, to be able to operate the robots, the sensors, and how to make sense of the information. The second perspective is then from a patient care perspective, as we do more teleconsult, telemonitoring, remote monitoring, then bringing in all these devices, gadgets that will help you to monitor and to care for the patients. So that's the patient care perspective. Then the third one would be the patient experience perspective. If they need to come to the hospital, then what's their journey like in the hospital? So you mentioned that you saw a video of Tock saying about touchless. So yes, from the point of registering themselves to going to the clinic, to seeing the doctor, how do we make this process a bit more seamless? How do we integrate the process so that they don't wait too long at the clinic, so that they get admitted smoothly? Everything can be self-help, and it becomes a more pleasant experience in a very busy hospital. We are a very busy hospital, so it can get a bit impersonal, right? So how do we make sure that we still maintain that relationship? See, in healthcare, it's all about relationship with patients. If the patients trust you, then you have that relationship. So building that trust using technology is very challenging, and that's something we are still grappling with. The last thing about how COOs can use technology, I use it a lot in supply chain. Mm-hmm. So ops efficiency, how do we do last mile delivery in the supply chain? Stocking up the wards, stocking up the clinics. How do we reduce the risk to my storeman, for example? So how do I use robots to stock up the wards instead of getting someone to go into an infectious disease ward? So I think we use a lot of those as well. You talk about a command center. So we have a nerve center that manages the entire workflow in the campus. So that helps us to get an understanding of where patients are, where the choke points are. So yes, I think there are a lot of opportunities to use technology. But I think the bottom line is don't implement technology for the sake of being sexy and being in the in thing. You really need to look at your processes first before you put the technology on top.
So moving on to the final question for our conversation today, Dr. Jamie, the role of operating models in defining business goals, transformations, and successes has skyrocketed ever since organizations have undergone digital transformation. So before we bid adieu, tell us how, as industry leaders, see the role of, how do you as an industry leader see the role of operating models evolve for the future?
Well, I think we can't run away from the use of technology. Right? So we need an open mind. We need to be able to embrace the use of technology. And with technology, what is going to be generated is a wealth of clinical data. And I thought what's important is to be able to make sense of the data, and therefore to layer the data with artificial intelligence so that we can convert data to meaningful information. And that's important because it is the information that will guide the decision support for both the patients themselves and also for the healthcare worker. So that's the trend moving ahead, decision support.
Yeah, I think a lot of conversations are happening about how data is extremely important, data and analytics to understand not just your patients, your workforce. I think a lot of decision insights and strategy can be brought forward with the use of the data and understanding data better. So that's a great thought. So on that note, thank you so much for this interesting conversation today, Dr. Jamie. We got to learn so much about how operating models have reinvented in the past 2 years, especially in the healthcare sector. It's a complete different story. And technology has, of course, played a great role in that. Not just technology; it's about it has just not helped in reassessing the business as usual model, but also in incorporating the new changes that were required to meet the demands of the world in light of this pandemic. So great thoughts there. Thank you so much. Going forward, operating models will keep evolving. Technology will play a great role in that. But as you said, the aspect of having trust for your workforce, for your patients will also remain as important going forward. So any concluding notes from your side?
Well, I would just say that, it is a long journey. Evolution takes steps, takes time. So hang on there, stay safe, everybody. And thank you very much.
Great. Thank you so much. That was a great session. Thank you so much for your great insights. So concluding this session, I'd like to once again thank Dr. Jamie for joining us here today. It has been a great pleasure. I would also like to thank everyone else from our audience. Do stay tuned for more such insightful sessions throughout the day today. Coming up next is an exciting case study presentation on delivering priceless experiences in the digital age by Rustam Dastoor, Senior Vice President, Head of Marketing and Communications, MasterCard. So please don't miss that. And thank you, everyone, and take care.